Okay. Right, this is a short video just to describe the sample vials that we use, our labeling procedures, our parafilming of the samples, and then the storage of the samples as well. So these are the samples that we normally use. They are 20 milliliter scintillation vials with a conical cap insert on the base of the cap. And this conical insert just displaces the water once you cap the vial to ensure that there's no head space in your sample. This particular one is glass, borosilicate glass, but you can also use plastic scintillation vials. Okay, so the first thing that we need to do is to label our vials. We have one labeled here. You should just do whatever labeling procedure you would normally use, but obviously we need to know the site name or site number, the date, the type of sample that this is. So in this case it's stream water, so we've put stream water SW1. We need to know what replicate it is, what replicate number it is, and also the time that the sample was taken. We also need to make sure that our vials are parafilmed. That's basically laboratory film, which we wrap around the cap to ensure that there's no evaporative exchange between the sample and the air on the outside. And this is important for storage and for transit. So this is the tape we use, the film we use. We've got a little section of it here. All you need to do is cut off a small section and then stretch it and wrap it around the cap, ensuring that it's tightly sealed around the whole thing. And it's just this bit that's important, the bit around the joint between the cap and the vial itself. So you do that for all vials. You can do that in the field if possible. That's most ideal. But if it's particularly bad conditions, if it's rainy, it's muddy or whatever, it's also okay to bring them back to the lab and to parafilm in the lab. Finally, storage of the samples. Ideally they should be refrigerated, not frozen, but if you don't have a refrigerator available, it's fine just to keep them in a cool, dark room.